If you want to apply mobilization technique to the knee joint to improve the mobility of the knee joint, then you need to do distraction and gliding technique. So you need to move back a little bit. Yeah, okay. You have to ensure that the knee joint is actually, no, relax. You have to ensure that the knee joint is actually free from the bed. Then take the knee into a semi-flex position, squat down, and apply a downward force to distract. You hold it for about 7 seconds and you drop it. You hold it again and you drop it. You hold it again and distract and hold it. Distraction is non-specific. So when you distract the knee, you are actually improving all the motions that you have at the knee joint. You can also distract the knee joint in supine lying. In this case, in prone lying, this is 90 degrees. Take it to 45 degrees from that 90 degrees. Stabilize the distal corner of the femur and apply an upward force, a distraction, by opening up the interarticular space. Hold it for 7 seconds, drop it back. Hold it. Drop it. Distract. If distraction is not giving you the desired result in terms of mobility of the knee joint, you may have to proceed to the use of gliding technique. And when you look at the concave-convex rule, you will realize that at the knee joint, the tibia is concave and the head of the femur is convex. But in this case now, unlike the hip and knee joint, you are actually mobilizing the concave surface because the tibia condyle is concave. And when you are using the concave-convex rule, so since you are moving the convex surface, then if you want to improve flexion, you glide in that same direction of flexion, and if you want to improve extension, you glide into extension. So you have an anterior gliding technique and posterior gliding technique for the knee joint. Posterior gliding technique, you first distract, then you glide posteriorly. If you use the concave-convex rule, that means if you do posterior gliding, you are improving flexion. You should not forget that you should do distraction before your gliding technique. So you distract first and then glide posteriorly. This will improve knee flexion. If you want to do anterior gliding to improve extension, then you have to bring your patient into prone lying. Okay? In this case, in prone lying, you distract, then look for the condyle and apply the downward gliding technique, anterior gliding. This will improve knee extension. So let's go over it again. Distract, then glide anteriorly. If you glide anteriorly, then you are improving knee extension.